unlocking emergency resources. The first step is ensuring that there is an immediate alignment of all legal and regulatory instruments to ensure that there exists no legal or regulatory impediment towards the mobilization of required resources to address this emergency. As such, by the powers vested in me by Section 17, subsection 1 of the Constitution of this Republic, I hereby declare a state of public health emergency, granting me the necessary powers to make decisions quickly to address the immediate medical needs of the nation. In addition to this declaration, I hereby set aside Clause 34, Subclause 3, A and B of the Retirement Fund Act 2022 to enable the establishment of the Health First Botswana Partnership, a 5 billion Pula fund to which the Botswana Development Corporation shall invest the initial sum of 100 million. The purpose of the fund is to facilitate strategic procurement of healthcare supplies to adequately support the public health system's needs, to align procurement activities with the Ministry of Health's comprehensive plan to ensure timely delivery of medicines, consumables, hospital machinery, and spare parts, to establish and strengthen global partnerships with reputable manufacturers and original equipment manufacturers, OEMs, to secure high-quality products at competitive prices, to implement streamlined procurement processes, including transparent bidding and contract management to enhance efficiency and accountability, to invest in capacity building for procurement personnel to improve negotiation skills, management and compliance with international standards. It will also incorporate sourcing strategies that prioritize local manufacturing and sustainable practices to boost the domestic health sector and ensure long-term availability of essential supplies. I appeal to all people of conscience to invest in this fund for the sake of the people of Botswana. Pension funds, insurance companies, medical aids, and any and all persons, the country is calling you to action. Take up the responsibility and show national solidarity to overcome the problems we are in. To further the provision of an immediate solution to the crisis, the Ministry of Finance has approved a waiver to bypass current citizen empowerment schemes that have contributed to cost escalations, and for the use of emergency procurement methods as provided in the Public Procurement Act to address this predicament the country is faced with. The alternative method is in accordance with Public Procurement Regulation number 30. This method shall be used under the direction of the Ministry of Finance, under the highest standards of transparency and accountability. Step 2, installing leadership to coordinate execution. A national task force of experts has been appointed, which shall immediately address availability of supplies across all national distribution centers in the country. It shall thereafter make recommendations for radical, world-class solutions to ensure that Botswana never finds herself in this position again. This national task force has already begun work. It commenced work on the 22nd August on a 24-hour shift to speed up preparatory work and it comprises Head of BDF Logistics Command, Brigadier Masunga. Presidential Advisor on Projects, Mr. Umpile Sihurutsi. Permanent Secretary in the Ministry of Health, Professor Ngomazan. BDC Caretaker Managing Director, Mr. Uteng Kiabetsu. Head of the Botswana Baylor Institute, Professor Muhomutsi Matsaba. The task force shall incorporate additional resources from government and or the private sector as may be required from time to time. And I implore all parties to heed the call when required. The task force shall report to a national steering committee that will be empowered to make all decisions pertaining to the work at hand. The NSC shall be constituted by the Minister of Health, Dr. Stephen Mudise, the Minister for State President, Mr. Mweti Muhasa, Permanent Secretary to the President, Mrs. Emma Peloi-Tletsi, Commander of the Botswana Defense Force, Placid Seroko. Step 3, procurement and distribution. On Thursday, the 21st of August 2025, the Ministry of Finance approved a virement request by the Ministry of Health to avail an amount of 250 million pula as emergency fund to facilitate the procurement of especially life-saving medical supplies. The procurement is happening in 2 phases. Phase 1 is the procurement of 6 to 8 weeks life-saving medical supply from qualifying local suppliers that have sufficient stock and pass quality standards. It is important to note that this procurement shall be led and overseen by the Botswana Defense Force. It is highly price sensitive given our limited coffers and is in line with fair and ethical pricing. As I address the nation at this moment, procurement is happening, and the first trucks loaded will leave Gaborone at 7 p.m. tonight to start their journey towards the furthest ends of our country. Phase 2, sourcing from suitable global aggregators and directly from manufacturers as a way to reduce cost. It must be noted that the current prices often are inflated 5 to 10 times, and under the current economic conditions, this scenario is not sustainable. To illustrate this inflation of prices, an estimate received from CMS for a full year's supply of the medicines needed right now stands at 705,369,748 pula and 9 tevi. A separate quotation was done by the task force for the same medicines in the same quantities, and the figure of those medicines dropped to below 80 million pula. CMS does not deny this inflation of prices and partly attributes it to policies passed under the previous government, which mandated the inclusion of several middlemen in the procurement process under the guise of job creation. These middlemen add no value to the end product received, simply adding markup after markup, leading to the unjustifiable depletion of government monies. You will decide for yourselves whether these middlemen have contributed to the employment of Botswana. I posit that they have not, by looking at the staggering figures of unemployment. Employment will be created through local manufacturing with clear value add and skills transfer to our local people. The second phase shall commence on Wednesday the 27th, when we have ensured that all facilities have started receiving medical supplies. Phase 4, fixing for the long term. In order to ensure that our country never gets plunged into this situation again, I'm hereby directing both the National Steering Committee and the National Task Force to research, make recommendations, and start the process of fixing our medical supply value chain challenges. This will include 1, automating the supply chain from end to end. 2, closely monitoring the pricing of procurement. 3, data analysis and data-driven stock management. I emphasize that the work has been non-stop, and it will remain so until medicine reaches all the shelves in the country. The work shall remain non-stop until the entire value chain of procurement has been fixed, so that the beautiful people of this country can sleep peacefully at night. To you, my beloved Botswana, I quote the words of Bob Marley: "You never know how strong you are until being strong is your only choice." I have seen through this crisis, through the work and dedication of several people in this government, through the silent work that has been done at homes, schools, and in social settings, through the quiet resilience of the people in the face of danger, that you are strong. It is your strength that has kept the nation calm in this storm. Peace is strength. Patience is strength. Your peace, patience, and trust are being repaid 1,000-fold, and together we continue to build the Botswana we aspire to have. Pula.